Hello, everyone. Welcome to Neurodiverse World, the channel where neurodiversity is explained with respect, clarity, and solid science, without judgment and without myths. Today, we're talking about a topic that might seem a little technical at first glance, but it has a direct impact on the lives of thousands of families. Why understanding the difference between screening and diagnosis matters so much. What I'm sharing with you here is based on clinical protocols and international medical guidelines, such as the DSM-5-TR and ICD-11, along with best practices recommended by specialists in mental health and child development. This is not just my personal opinion, it's science, translated into simple language so that it's easy to understand. Let's dive in. Before we get into the details, we need to be crystal clear about what screening is and what diagnosis is. Many people confuse the two, and this confusion can lead to misinterpretations, delays in starting interventions, or even unnecessary stigma. Screening is like an initial filter. It's designed to identify possible signs of a condition, but it does not confirm whether the condition is present. It's usually quick, often done with questionnaires or checklists, and can be carried out by a variety of professionals: trained teachers, nurses, psychologists, or primary care doctors. For example, the MCHAT-RF is a screening questionnaire for early signs of autism in young children. Diagnosis, on the other hand, is a much deeper process. It can only be made by qualified professionals, usually psychiatrists, neurologists, or psychologists with specific training in diagnostic assessment. It involves detailed interviews, clinical observation, standardized testing, and careful analysis of developmental history, behavior, and context. In short, screening points to a possibility. Diagnosis confirms or rules out the condition based on rigorous clinical criteria. Now that we've got that foundation, let's look at 7 reasons why understanding this difference is so important. 1. It prevents false expectations. When a screening suggests there's a higher risk for a certain condition, it doesn't automatically mean that the person has it. For example, a child may score high on an autism screening, but not meet the full diagnostic criteria during a clinical evaluation. Maybe the behaviors are linked to something else, like anxiety, language delays, or environmental factors. Understanding this avoids panic and keeps adults from self-diagnosing too quickly. 2. It allows for faster support. Even without a confirmed diagnosis, a positive screening result can open the door to early supports and adaptations. For example, if screening shows possible communication difficulties, speech therapy can begin while waiting for a specialist appointment. This is crucial because for many neurodevelopmental conditions, early intervention significantly increases the chances of progress. 3. It reduces stigma. When people understand that screening is not a final verdict, it's easier to discuss results without fear of labels. A positive screening result is simply an indicator for attention, not a permanent definition. This encourages teachers, families, and peers to offer support without treating someone as if they are defined by a condition that hasn't even been confirmed. 4. It improves communication between professionals and families. Professionals who clearly explain the difference build more trust with families. Instead of creating confusion, they make it clear. We're seeing some signs that deserve further investigation. The next step is a more complete diagnostic assessment. This transparency reduces anxiety and increases a family's willingness to follow through on recommendations. 5. It ensures the right referrals. A well-done screening points to who should be referred and where. This prevents wasted time and resources, like sending a child to multiple specialists unnecessarily, while ensuring that those who truly need diagnostic evaluation don't get overlooked. 6. It protects against mistaken diagnoses. Confusing screening with diagnosis increases the risk of error. A common example: people with ADHD may score high on an anxiety screening, and vice versa, because some symptoms overlap. The detailed diagnostic process is what separates one from the other, avoiding unnecessary or inappropriate treatments. 7. It empowers patients and families. Understanding this difference gives people more control. Families and individuals learn which questions to ask, what steps to take, and what to expect at each stage of the process. Instead of passively waiting for a doctor to tell them what it is, they actively participate in the process. I understand what's happening and how I can help. So here's the practical takeaway. If you or your child has taken a screening test and the result suggests a possible risk for a certain condition, don't stop there. Seek out a qualified professional for a full diagnostic evaluation and bring the screening results with you. They'll serve as a useful starting point for the assessment. And remember, a negative screening does not guarantee there is no condition, and a positive screening does not confirm that one exists. It's only a step within a much broader process. If this video helped you better understand this topic, give it a like and subscribe to the channel. Share it with family members, teachers, colleagues, and healthcare professionals, especially those who still confuse screening with diagnosis. This kind of information can prevent a lot of unnecessary worry, delays in treatment, and even misinterpretations. Here at Neurodiverse World, every video is made to deliver science with empathy and to strengthen understanding of the autism spectrum and other neurodevelopmental conditions. Your engagement, your comments, and your sharing make all the difference in getting high-quality information to more people. Thanks for watching, and see you next time.